Hello, I'm Kevin O'Neill. I'm Clinical Director for Mahajan Therapeutics, and I've been asked to talk a little bit about the holidays and the impact on men in terms of dealing with stress. Uh, and it was thought to be a good idea to talk about this as November is Mental Health Month, and we have holidays coming up in a very particular kind of circumstance, the COVID uh, pandemic. Statistically, it's shown that women seek mental health services a lot more frequently and a lot more quickly than do men. However, on the other hand, it's also statistically shown that men tend to resort to the use of alcohol and drugs to deal with stress almost twice as much as women. This can cause some problems in that when we're not dealing with the stresses that we're experiencing, the stresses are still there. When we suppress them or try to put them to sleep with drugs or alcohol, it doesn't mean that those stresses are gone. It just means that they're buried momentarily. These can cause a lot of problems. It can cause a lot of medical problems. It can increase the difficulties with heart and heart related problems. It can cause difficulty with blood pressure. It can cause difficulty with the digestive system and any other number of systems within the human body, including muscles and chronic muscle pain. It can also create difficulties with relationship issues. When we suppress the stressors or try to numb them, those stressors are still there and they're going to come out indirectly in rather destructive ways in terms of the way we interact with our family and friends and those that are closest to us. It can also impact our ability to work in terms of attendance issues and performance issues that can be of great concern. It is generally recommended that we find ways to deal with these stressors rather than to try to sweep them aside. There have been many cultural changes that have occurred over time. Uh, what happens though is that it takes our DNA quite a while to catch up with those changes. Traditionally, men have been protectors and providers, and currently, men still often take on those responsibilities or feel those responsibilities and see those as expectations of them. As providers and protectors, certainly there are women that are the main income providers in many homes, but men still tend to feel the responsibility as a protector and provider. During the holidays, many of these concerns can become very stressful. Because of COVID, a lot of times people find themselves in financial difficulties right now, having lost time with jobs that were shut down temporarily or permanently, or when there were reductions in personnel. Uh, this is a time when the people closest to us may have some expectations in terms of gift giving and things like that, when those are just not feasible for us. And that could be hard in terms of how we see ourselves as the provider in some of these relationships. Also, visiting families occur more during the holidays and visiting our friends. When family interactions have historically been not very good or it's destructive, going back into those relationships can bring about triggers of things that have been in the past, and it can cause us to regress sometimes into those prior patterns. Also, when we're hanging around with friends that perhaps we used to use drugs or alcohol at the time of those relationships, those can serve as triggers for regressions in that area as well. During this time of COVID, we are encouraged to stay isolated from each other in terms of social distancing. This is very difficult because one of the main sources that we have to buffer ourselves against stressors becoming mental health issues are the connections that we have, the physical connections, the emotional connections that we have. Also, COVID causes many concerns about ourselves or our families or our friends coming down with COVID, and that can cause a great deal of anxiety. The risks of not handling stressors appropriately are, first of all, depression. Depression is when we find ourselves with a decrease in energy, a decrease in motivation, a decrease of interest in the things that used to give us pleasure, decrease in self confidence. And in men, particularly, depression can exhibit itself as increased irritability and anger. Anxiety is pretty clear about itself. It's when we're stressing out about things, worrying about things that causes us to be tense. And again, in men, anxiety is often exhibited primarily in increased irritability and anger problems. And so, as men, oftentimes under these kinds of stressors, we may have some difficulties in terms of managing our irritability or our anger. And it's shown and it's panning out that during COVID, there has been an increase in domestic violence as well as drug and alcohol use. And men are specifically subject to these kind of vulnerabilities. In mental health, we are able to help clients discover some things that they can do to reduce those stresses and to manage them and to be relieved of them. There are therapies like cognitive behavioral therapy, which are very good at helping us to control or reduce the thoughts that tend to worsen depressive and anxious symptoms, and as well as anger concerns. We also are able to help clients be able to find some grounding, some ability to put those thoughts aside for a time and to just be and to experience themselves, have more physical awareness of themselves. And that includes some grounding exercises that all of our therapists are able to help clients develop. We also we have available at Mahajan Therapeutics also biofeedback, which makes it very really helps people to learn to control themselves and to bring them into a state of coherence, which is a balance between the sympathetic nervous system and the parasympathetic nervous system. It helps with all those problems with depression, anxiety, and anger. We also have some techniques for thought stopping that can interfere with affective reasoning and negative chaining, which are typical thought patterns within depression and anxiety. And I plan to cover those in more specific terms in future talks, but we'll leave it at that for tonight. But if you're experiencing yourself with increased depression or increased depression and find yourself being increasingly irritable and having more difficulty with anger, I'm sure that you may find yourself not being the kind of person that you want to be right now, not interacting with your friends and your family the way you want to be. Just know that there are ways that you can deal with those stressors and improve your interactions with those that you care about most. And you can be helped by calling Mahajan Therapeutics. The contact information is on the website, or any mental health agency in your area, and encourage you to do so that you can experience yourself the way you want to be.